The Best Docs Network helps you find some of the best doctors utilizing the latest procedures and practices in healthcare. Actual patients and the doctors themselves walk you through their stories that together help you make the best decision in your search for the right doctor. On today's episode, facial plastic surgeon Dr. Yadro Duchik discusses the importance of good skincare for his patients. Houston Northwest Medical Center features its breast center. ENT Dr. C.T. Wynn relieves his patients' inability to breathe and nasal congestion by diagnosing their deviated septum. And doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
I would wake up every morning sneezing. I'd go into the bathroom and I'd sneeze over and over again, and really prevented me from doing any yard work. And so I would just kind of stay in the house and as much a filtered environment as possible.
Barry came to see me because he can't breathe out of his nose. He reported having nasal congestion, facial pressure, headache. And in addition to that, he suffered from obstructive sleep apnea that required him to wear a CPAP every night.
It started back when I was in grade school, and it just has gotten worse and worse and worse over the years. And most of the other doctors I've always visited would treat symptoms. I just assumed that's all they could do. And when I went to see Dr. Wynn, he said, no, here's the problem and here's a solution.
We noticed that Barry turbinate, which are structure on the side wall of his nose, are very swollen, restricting his airway. Also, Barry's sinus narrow and prevented him from breathing well. We discussed those findings with Barry and agreed upon a plan of treatment. First, reducing the size of the turbinate, allowing him to breathe better, and also using a small balloon to dilate the natural passage of his sinus cavity.
It took probably 2 weeks to feel really great. Progressively over that time, the breathing improved. It's amazing. I told him I've never ever been able to breathe through both sides of my nose, and now I can.
After going through a small procedure in office of 45 minutes, now Barry enjoys life, breathes better, do more outdoor activities, and the most important thing, it reduces his dependency on CPAP machine, and he now can sleep better.
I was amazed because it was like finding somebody that was really willing to just do something more than put a Band-Aid on it. It was really exciting. Wish I would have found him 10 years ago.
Eating eggs for breakfast not only tastes good, but they help to slim you down. Each egg you eat has 6 grams of protein, but only 72 calories.
We went to see Dr. Kaufman because we have a genetic disorder in our family that we were hoping to screen for before we had children. From the moment I walked in the door, I felt really comfortable. We explained to him what our issue was, and he said, yes, we can do that. We do it all the time. And so we sort of felt immediately that we were in the right place. And one of the things that we really appreciated from Dr. Kaufman is he sort of stays on the pulse of all the most recent, scientific findings as far as IVF is concerned.
The most recent advances we actually have in that area would be egg freezing. The second area would be diagnosis of genetic diseases with the embryos. And third would be just the overall how we do in vitro fertilization, as far as culturing, transferring, and those type of things. The other technology that's evolved is pre-implantation genetic diagnosis or pre-implantation genetic screening. And that's where we can actually remove cells from the embryos and do analysis on it. I actually did research about 20 years ago taking a look if removing these cells from embryos would harm them, and we showed that it didn't, preclinical studies. My laboratory director here, he's done over probably 3,000 of these type of embryo biopsies, and so I think it's a matter of expertise as well.
About 2 months after the beginning of our process, we found out we were pregnant. We were very lucky in that it, for us, worked the first time with our first child. When he was about 2 years old, we decided it was time to have number 2, and there was sort of no question that we were going back to Dr. Kaufman. We had already sort of informed him that we would be in the near future coming back.
They've got now 2 children through this technology, and it's just wonderful that you can actually prevent a disease from occurring before even having the baby.
Dr. Kaufman and all of the people in his office do an amazing job of making you feel comfortable from the moment that you walk in the door. They assess what your problem is, they meet it head on. They walk you through the process, and with us, we were very lucky to have 2 healthy boys, and we will be going back to him for our 3rd.
To learn more about Forest Park Medical Center and their doctors, go to bestdocsnetwork.com.
Do you have missing teeth, need crowns, veneers, partials, dentures, or a full mouth reconstruction? Prosthodontist Dr. David McFadden will give you back the youthful appearance and confidence you deserve. Backed by credibility and credentials, Dr. McFadden is cosmetically changing his patients' lives one smile at a time. Call today or log on to dignitydental.com. Dr. David McFadden, your go-to dentist in the Dallas-Fort Worth area.
I didn't feel good about myself, and I never wanted to go anywhere. Now my world has opened up. I occasionally go out with my girlfriends, and we have a great time together.
I was getting older and didn't really care about my weight, but my doctor said I needed to do something immediately. Now I'm spending time with my grandchildren, and every moment seems special.
My one reason was to live life again.
My one reason was to simply live.
So what's your one reason?
Barker Bariatric Center. Log on or call today for your consultation.
Connie has a question for Dr. David McGee. What can I expect after having a colonoscopy?
Well, immediately, you'll be a little groggy when you first wake up. Most people come out of a really nice dream state and a little bit irritated when we wake them up because they're in a good place. Within about 5 to 10 minutes, you're almost fully awake. It might be like you had a slight drink at that point. By about 20 minutes after the time is up to leave, most people walk out feeling almost 100% fine, ready to eat because they're usually hungry. If we do remove any polyps at that point, I will show you pictures, tell you how many, tell you what my impression of them, whether I'm concerned about them, but I don't make any assumptions. All polyps go in a jar, they're sent off to pathology, fully dissected. There are different types of polyps. Most are what we call adenomatous that do have the risk of turning into cancer in the future. There's even a type called hyperplastic which don't have any risk of turning into cancer in the future. So based on what type, how many polyps you have, what type of pathology shows up, I make a recommendation as to how soon you should have your follow-up colonoscopy once I get that report and call you a few days later.
Ask our doctors on bestdocsnetwork.com.
So before I met Dr. Duchik, I just felt like my skin was dull and spotty and splotchy and was constantly trying to search for makeups that would make a difference transitioning into my 50s.
Skincare is obviously very, very important. The skin is what everybody sees. They don't see the underlying bone. If we do somebody's rhinoplasty, they're not looking at their cartilages, they're not looking at their jaws, their cheekbones, their eye sockets. They see the skin. That's the first thing that you see. So ideally, you want the skin to look as good as possible.
Typically, Dr. Duchik does like me to see patients before they have surgery. He'll do a consultation and he'll send me in the room and say, please talk to them about skincare. Let's get their skin looking good first, and then we'll, discuss surgery.
I always feel at home with Jennifer. She is a very well-versed in skincare, and she pays attention to my age, and we stay really focused on what it is that I'm trying to accomplish.
Well, the whole point of doing cosmetic surgery on somebody is to make them look better and feel better about the way they look and more comfortable in their own skin, so to speak. And so one of the first things we always try to do is tune up the skin, make the skin look as good as possible, because then People oftentimes are so happy with their skin that they don't feel like they need to sometimes even do surgery.
As you get older, your body you lose the collagen in your skin. Collagen's kind of like the springs in a mattress. You start to lose volume, and you'll start to notice fine lines and wrinkles. By stimulating the collagen, your skin will become firmer and the wrinkles will start to dissipate. There's several different things that we offer that help stimulate collagen, one of them being the Dermapen. It creates micro injuries to the skin, and when the skin starts to heal, it starts to rebuild collagen, which is pretty amazing.
And the goal is not to do surgery, the goal is just to make somebody look better.
I no longer have to search for makeups that cover up. I just feel younger than I thought I was going to feel in my 50s, and just feel brighter, and that my skin finally is at a place where it's glowing.
Request an appointment on bestdocsnetwork.com.
A tomato is a superstar in the fruit and veggie categories. Tomatoes contain lycopene, a powerful cancer fighter, and they're rich in vitamin C. The good news is that cooked tomatoes are also nutritious, so use them in pasta, soups, casseroles, and salads.
Here at Houston Northwest Medical Center's Breast Center, we focus on the patient and giving them the best quality care possible. The Breast Center here at Houston Northwest is a comprehensive breast center, meaning that not only can we do screening mammograms, we can also do the diagnostic portion, ultrasounds, MRIs, and biopsies.
I'm currently the medical director at Houston Northwest Medical Center. My primary role is interpreting screening and diagnostic mammograms, breast ultrasound, and breast MRI for detection of breast cancer. Also to determine clinical issues. If a patient comes in with a palpable lump, we want to find out what it is. It doesn't mean it's going to be breast cancer. It may be a simple cyst, it may be a benign tumor, but that is part of the workup that I'm involved in.
All of our nurses are certified nurse navigators here. They help the patient walk through the system, whether it's just for a screening mammogram or all the way through surgery. They help them navigate their care.
At Houston Northwest Medical Center, we have 4 breast patient navigators. We are very fortunate to be able to do what we do. Very few hospitals in the area have the opportunity to have this many nurse navigators, and from the beginning, from screening, from going out into the community, it's all about deliverance of care and continuity of care. So if you just make sure that that care is not broken, then one passes a torch to the next person to make sure from the time that she got her biopsy, from the time that she got her diagnosis, that we actually use the library to give her all the information that she needs to arm herself before she goes to see the surgeon.
At Houston Northwest Medical Center, we're very fortunate that we have a multidisciplinary breast cancer conference every 2 weeks, so twice a month. Every patient that is diagnosed with breast cancer at this hospital will be presented at a conference that is attended by radiologists, pathologists, breast surgeons, oncologists, radiation oncologists, and plastic surgeons, and the nurse navigators.
This is an excellent way for the patient that has been recently diagnosed have a treatment plan mapped out for her by specialists that come to the breast conference.
The Breast Center at Houston Northwest Medical Center is the only certified center of excellence in Houston, Texas. We have a monthly support group called Care, Share, and Be Aware, where newly diagnosed patients can come and share their feelings. They can also bond with other breast cancer survivors to interact with them and learn from them.
We always say no one chose this journey, but if you're walking the journey, you're not going to walk it alone, because we're going to walk it with you.
Coming up on the second half of today's show, cosmetic dentist Dr. Guy Lewis gives his patient renewed confidence with her new smile. minimally invasive spine surgeon, Dr. Douglas Wan, talks about his approach to spine care. Interventional cardiologist, Dr. Annie Varghese, talks about hypertension, as well as more doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
I noticed something wrong in July of 2008. I actually went to a routine doctor's visit for some breakout that I had, because I had used a different type of deodorant. And when they took my blood pressure, they said that it was, unusually high.
Hypertension, what can it cause? And some people think, well, their blood pressure is a little bit high, they can take a medicine, or maybe they just don't have to take it every day. A lot of people take this idea of hypertension kind of casually, but we shouldn't, because high blood pressure can cause problems from stroke to heart attack to kidney failure. So many things can be caused by that one word, hypertension.
Ended up inevitably going to the emergency room like a couple of days after because I just started feeling really dizzy, headache. It was as if my heart was actually hurting inside of my body. The blood pressure was 200 over 110. When I came to see her, her first words were, "We're going to heal you." And I was like, yes, came to the right place.
She has been committed and faithful to take her medicines and to take care of her body to protect her heart, because high blood pressure can lead to many other things, especially cardiomyopathies or weakening of the heart, heart failure from diastolic heart failure or systolic heart failure. So we have prevented that in her, and she's doing very well.
Before, I would feel sluggish, tired, anxious a lot, and a little headaches like that. And then after, once we started treatment on medicine, different medicines, I would feel better. I would feel like I had energy. I just felt better and good about myself.
If the pressure is too high, too much damage can occur in the organs. We have to take it seriously, and we just need to educate patients, I believe. If patients really knew what it was all about, they would come and get checked and take their medicine.
I believe that Dr. Varghese has been blessed from the Lord with life and favor, in her hands. And I just love that about her.
Find your doctor on bestdocsnetwork.com.
I was in a lot of pain. I couldn't wear shoes. If someone were to ask me, would you like to go to the mall and walk? No. Too painful. Do you want to go on a drive where I had to do the drive? No, too painful. Pretty much I excluded everything but work.
Well, bunions are a genetic deformity. They're usually occurring at the big toe joint. It's a deviation of the big toe where there's a bump on the inside of the foot. Kelly is a great patient. She came in last year, towards the end of the year, and she was having pain on her foot. It was a classic presentation, always hurting. It didn't matter what type of shoe she was wearing, what she was doing. There are different types of surgical procedures that we utilize. It all depends on how big the bunion is. And then we take in consideration the patient's activities. Do they work or not? Can they give me enough time in the recovery period to give them the best chance to recover properly? I really want my patients to be educated and knowing everything that can be done for bunions so they can go out and teach other people about their problem.
I love him. I have never met anybody like him. It's like you come in, you don't feel comfortable, he makes you feel comfortable. You have a problem, a question, don't be afraid to ask. Is there anything else we can do for you? I mean, just constantly. Have you heard of that with any other doctors out there? No, I haven't. After the first month, it got better. And then I got ready to do therapy. And that's when I saw the big improvement. It's been about almost 6 months. You never know I had surgery. It feels great. I mean, I'm wearing sandals I haven't worn in years. I love it. I can't wait to go get my toes done.
To learn more about Forest Park Medical Center and their doctors, go to bestdocsnetwork.com.
To avoid your child being poisoned, be sure to store all medicines and household products up, away, and out of sight in a cabinet out of their reach. Poison Control reported 9 out of 10 poisonings in children occur in your home.
Watch more videos on bestdocsnetwork.com.
And we welcome you inside the Best Docs Network studio. We are happy to be joined by Dr. Doug Wan. And when it comes to spine and neck surgery, this is your go-to doctor. He is also the director and founder of Spine Care. Dr. Wan, welcome to the program.
Thank you. Thank you for having me.
Let's start it off with your philosophy when it comes to your approach to medicine. What would that be?
So we practice medicine based on, our approach is very patient-centric, providing the best care for the patient. And when it comes to spine care, spine problems are a very complex issue. And so our approach is to approach it with a very comprehensive approach. So in our center, we have from the least invasive way to the most complex way of treating spine conditions. And we have providers such as chiropractors, physical therapists, physical medicine rehab doctors, interventional pain specialists, and minimally invasive spine surgeons. And we approach it through a multidisciplinary approach and find the best way to treat the patients so that they get the most amount of pain relief.
All right, doctor, what was your goal in creating Spine Care? What did you have in mind?
When we created Spine Care, our goal is to provide the best kind of spine care to the patients. There are many patients with very complex spine problems. However, not everyone may need spine surgery, so we approach the spine through a multidisciplinary approach, and we find the best way to treat the patients with significant back pain. That's why we have from the chiropractor to physical therapists, physical medicine rehab doctors, interventional pain specialists, and minimally invasive spine surgeon. We find the right diagnosis and treat the patient the right way and the least invasive way possible so that they can get their life back as soon as possible. Also at the Spine Care, we have high-level imaging so that patients do not have to travel elsewhere to get their imaging studies done. Also, we have our own procedure centers on campus, so therefore they can not only get the evaluation, but also pain procedures done, as well as spine surgery.
To see the rest of this interview, as well as other outstanding videos, head to bestdocsnetwork.com. Betty has a question for Dr. Ayula. Is weight loss surgery safe for me?
Weight loss surgery is very safe. In fact, for patients that have comorbidities such as diabetes and high blood pressure, it's probably safer to have the weight loss surgery than not to. The #1 cause of death in this country is cardiovascular disease. And the causes of cardiovascular disease are high blood pressure and diabetes. So if you're a diabetic and you're overweight, or if you have high blood pressure, it's very important that you treat those comorbidities. Even if your weight isn't that high, if weight loss surgery is appropriate for you, it would help with those comorbidities and is actually safer for you to have surgery than not to.
Ask our doctors on bestdocsnetwork.com.
I had a double mastectomy, and they needed to round out one of the breasts with more tissue. So they took it from my stomach.
She'd always been bothered by her stomach. Her stomach was kind of bulging and out of proportion to the rest of her body. And she thought, you know, I went through this trauma with the breast cancer. Now it's time to do something nice for myself. And so she elected to go ahead and have the tummy tuck to improve the shape of her stomach.
I've had 4 children, 2 naturally and then 2 cesarean. And you start to get a pouch and scar tissue buildup. So, you know, I want to look sexy again, feel sexy.
A tummy tuck can really benefit a wide variety of people. Usually it's what we see is women who just have extra loose, saggy skin in the abdominal area. Oftentimes it's either from pregnancy or from weight gain. They've tried dieting, they've tried all the gyms and working out, and they still have that just loose, saggy skin, or that little just pooch or bulge in the lower abdomen that they just cannot get rid of.
The difference is looking at myself and not seeing a stomach protruding, where I can put on clothes and I feel good. You know, I feel sexy. You know, I can wear a bikini, where I couldn't do that since 4 children ago. So, you know, it just brings that sexiness back.
She had a dramatic improvement. Before the surgery, she had just a very thick layer of fat on her stomach. She had stretch marks, loose, bulging skin, pretty much all around her entire waistline. After the surgery, we were able to remove a great deal of skin and fat and give her a nice, smooth, flat contour. A great deal of the stretch marks were removed. Everything was nice and firm and tight once again.
Oh, after having 4 kids, I've always wanted to have a tummy tuck. I just, you know, wanted to get back to me. I got my sexy back.
Request an appointment on bestdocsnetwork.com.
After my pregnancy, I started seeing my teeth weakened with the pregnancy, and I started having some issues. My cavities were profound, and it had affected my teeth. I wanted to have, you know, where I could smile, and I think about being embarrassed about my teeth and the way they looked.
And so she came in and she wanted to see if something could be done. And I think she was real apprehensive about, man, this is going to be really bad. And, you know, yes, she needs some work done, but I could see, and because this is what I do, the great majority of the time, this is what my emphasis is, you know, I knew I could fix it and make it look awesome.
I'm glad to say that, you know, he gave me a solution, and, you know, there's hope. We could get you that smile, no problem. And that was like the biggest relief ever.
Giselle is an example of what I see a lot. People come in, and unfortunately, a lot of them have been to dentists who have told them that there's not much hope for them, or they can't do a certain procedure, or they only give them like one option, and it's not a very good option. I think one of the advantages to coming here is that people can have hope when they've been told there's no hope, or have options when they've been told maybe they only have one choice of how a treatment can be. And so I'm confident in what I do that I can deliver a result and make it look great.
I don't have to think about it anymore. When I smile with confidence, and that's something I don't even think about. It's my smile says everything. People think I'm happier now. People think like, oh, what a happy lady, you know, because I smile more.
So now Giselle is very happy. She's more self-confident. She's more vibrant. She just loves life, and she just exudes that. Giselle's just full of life, and she looks great, and very, very happy.
The confidence that it brings, that you get from having a good smile and having a confident smile, is invaluable. I definitely know that if you go to Dr. Lewis, he's going to give you the smile that you've always wanted.
Watch more videos on bestdocsnetwork.com. Didn't find the doctor you're looking for on today's episode? Head to our website, bestdocsnetwork.com. There you can search our video library by topic, specialty, and doctor. The Best Docs Network, helping you find the right doctor and bringing medical education to you.